I'm Dr. Ellie, and I heal kids. And I'm here with my podcast today. And if you don't know me, my practice is Middle Path Integrative Pediatrics. I'm located in Asheville, North Carolina. I'm accepting new patients for primary care, 0 to 21 years old, and also functional medicine patients ages 2 years old to 102 years old or older. If you are beyond that age and you want a functional medicine consult, I'm here for you too. Today, I want to talk about ear infections. So it is, at the time of this recording, is October 29th, 2024, and we're in the middle of fall. So it is full on ear infection season. And a lot of people have questions about how to treat ear infections naturally, or what is the integrative approach for ear infections. So I do want to talk about that today, because ear infections are a big deal. You might just think, oh, it's just an ear infection. Don't worry about that. It'll resolve, or maybe I'll get some antibiotics, no biggie. But really, it costs a lot of, pain. It costs sleepless nights to parents and kids. It can cause missed school days, anxiety, really a lot of unwelcome effects. So we just want to make sure that we do understand, what is an ear infection and how to treat it. So when we talk about ear infections, a lot of times we're talking about an inner ear infection, a middle ear infection, called acute otitis media. So that's the medical term, acute otitis media, AOM. But really, we're talking about a middle ear infection. There's a few other different ones that we'll talk about in other podcasts, but for the case of this podcast, we're talking about middle ear infections. And this occurs when fluid gets trapped behind the eardrum. And what happens is, typically your kid gets a cold, or they get allergies, or something happened where they're getting fluid behind the eardrum, and it just creates a mess. It creates like a swampy kind of situation behind the eardrum, and it allows bacteria to grow, viruses to flourish. This liquid that's just sitting there behind the eardrum can get infected, and it causes a lot of pain when that happens. And in young kids, 5 and under, this is a lot more common because of the positioning of the eustachian tubes. And what the heck are the eustachian tubes? It's these tubes that basically are behind the eardrum and kind of drain down towards the head and neck. And because in young children, they're more horizontal than pointing downward, the fluid just kind of gets stuck there. And that's why young children get ear infections a lot more than older people. They're particularly susceptible. So what are some signs of an ear infection in young children? What are the signs? I mean, an older child can tell you, hey, mom, dad, my ear hurts. But what are you looking for in younger kids? So if your kiddo is pulling at their ear, they're tugging at it, or like young infants, sometimes they'll just kind of swat at their ears, or they'll scratch, and you're like, what are they doing? Are they just playing with their ear? I'm not sure. That could be a sign of a middle ear infection. And some other things that can be a problem is trouble sleeping. So now all of a sudden your kiddo who's been sleeping well through the night is waking up, they're crying, they're fussy, they're uncomfortable. They're just, in pain, basically. And that's why they're waking up. Fever, which is 100.4 Fahrenheit or 38 C for those of you who are on the centigrade Celsius scale. If your kid has a fever, 100.4 or 38 or higher, sometimes that can be a sign of an ear infection, especially if it's, a little bit higher than that even. Sometimes that's a sign as well. Sometimes the fluid builds up so much behind the eardrum that you actually start seeing kind of leakage out of the ear. Like maybe your kiddo wakes up and there's like this wetness on their pillow, and maybe there's even a little pus, or sometimes, God forbid, you'll see a little blood come out and you're like, oh my gosh, what is that? That can actually be a burst eardrum. So that's another sign of an ear infection. And lastly, trouble hearing. So sometimes kiddos, they get really used to things and they're like, my ears hurt. I'm used to it. It's been going on for, months, and they're very hardy. Kids are hardy, and they will put up with kind of chronic pain and just, not really act like they're sick. But the thing that you're noticing is that they are having difficulty hearing you. And you're like, why is it my kid who's always listened before, 1 in 3 times they're not even paying attention to me now. They're not even turning their head and looking at me. And that can sometimes be um, an ear infection as well. So let's say you're seeing these symptoms, and you're worried could be an ear infection. And, certainly some ear infections do resolve on their own. Many of them are viral, and, antibiotics would actually be harmful because now we're treating something that doesn't need to be treated with, something that kills bacteria, and there's no bacteria there. We've got a viral ear infection, and, now we're messing up the microbiome for no reason. However, of course, there are times that we would need to use those. So when in doubt, reach out. That's what I always say. Make an appointment. But what can you do in the meantime before that appointment? One thing that really can help alleviate pain are doing warm compresses. And what the heck is a compress? So anything that's like a warm washcloth, or if you have one of those little rice packs that you can heat up in the microwave and just kind of place it over the ear, that can help alleviate the pain. It can encourage circulation to the area. It may help clear the fluid out. It's a great first line remedy that you can do to provide comfort throughout the day and night. And so another thing that you guys can do is garlic. So garlic is great for ear infections, and you can certainly make your own garlic oil at home, but most people choose to buy just for convenience purposes, of course. And garlic drops are great. They help reduce inflammation. They help alleviate ear pain. They can be antimicrobial. Just word of warning, if you are making garlic oil drops at home, never put them in the ear warm. Warm is fine, but hot, obviously, that can cause burns. So don't heat it up in the microwave. Don't, heat it up in the pan and then put it, right in your kids' ears or anything like that, because that could be painful. And another thing you guys can do at home is xylitol. So xylitol is a natural sweetener, which is, a great way to help, prevent bacteria from adhering to the nose, adhering to the ears, the throat. And so, sometimes using xylitol gum intermittently, or lozenges, toothpaste, nasal sprays, those things can really help prevent ear infections and, move some of that bacteria and viruses along. Last, herbal ear drop. Well, I guess not last. The next one is herbal ear drops. So you can do things like calendula, mullein, St. John's wort. All of these are helpful for reducing ear infections. Just don't use, and this goes for the garlic oil as well, don't use those if you feel like, God forbid, your child's eardrum may have burst. And again, signs of that would be leakage out of the ear, pus or fluid or blood, something like that. Then you don't want to use it. We also want to make sure that you're boosting your kids' immune system. So, we want to put the body in a position that it's not getting infections all the time. And how do we do that? Well, nutrition is definitely one of them. And, because nutrition sometimes does slip, we do want to make sure that your kid has a lot of nutrient-dense, vitamins in their diet, like A, C, D, and zinc. D in particular has been shown to reduce the frequency of ear infections, and probiotics, which help maintain a healthy gut and healthy immune system. All of those are really helpful. Chiropractic, osteopathic, craniosacral therapy. So let's talk about that. So sometimes the positioning of the tubes inside the ears is what is the cause of the infections. And we need to do gentle adjustments to get those back into place. And so there are people that specialize in this, and, pediatric chiropractors are one of them. Sometimes there are great body workers, craniosacral therapists that can adjust the eustachian tubes so that they are back in the right position. And don't forget about inhalation, steam inhalation. We want to thin out any mucus secretions if your kiddo has a cold, and that's sort of, creating the cycle of ear infections. We want to make sure that you have steam so that, the fluids, the secretions are getting thinned out. They're drinking lots of water for the same reason. Everything's getting thinned out. And, ways to do that would be, a warm bath with a couple of drops of eucalyptus oil. You could do, for an older kid, like a big, hot bowl of water with a couple drops of eucalyptus oil, put a towel over their head. Or if you have a gym or something, in your house with a big sauna, and you're so lucky to have, something like that with the steam, then you could definitely do that for, getting all of those secretions out as well. When do you want to seek medical help? So, you do want to come in and see me sometimes to make sure that everything is okay and that things are getting better with some of these home interventions and herbal interventions that we talked about. If your kiddo is experiencing severe pain, please definitely come in. If they are having an exceptionally high fever, they are having drainage from the ear, you think the eardrum may be burst, the symptoms are lasting more than a few days without improvement, or you've tried all of these things and nothing seems to be working, then definitely, come in and do an appointment. Or any kind of concern where you're worried like your kid is not drinking well, they're so lethargic, they're not waking up for meals. That's obviously more urgent. They're so lethargic, they're not waking up to play. Those things are really urgent. So if your kid is looking really sick to you, lethargic, not drinking, not peeing, high fevers, all of that, then you definitely are wanting to seek more urgent care and don't just wait at home. So, final thoughts on ear infections. So, in this episode, we're talking about middle ear infections. There's a lot of things that you can kind of do that offer gentle support, holistic treatment. There are things beyond this with dietary, homeopathic treatments as well. But I think we did sum it up in a nutshell. Of course, you always want to talk to your healthcare professional before starting these treatments so that you can make sure that they're safe and effective for your child. With thoughtful care, many children can experience fewer ear infections and really enjoy happier and healthier days ahead. So if you did enjoy this episode, which I think is a good one, please share it with other parents. Please subscribe and please reach out for a complimentary meet and greet. So my practice is Middle Path Integrative Pediatrics. I'm in Asheville, North Carolina. If you can come at least once a year to Asheville, North Carolina, then you can be part of the practice for primary care. And I'm also offering functional medicine consults for kids 2 to 102. So if you're having any issues like that you need care for, please reach out again. Again, middlepathintegrativedpediatrics.com. Just click and sign up for a complimentary meet and greet. All right, wishing you well. Bye, guys.